Picture this: you're in the gym, ready to crush your workout, but something feels off. You're lacking focus and energy, and you're struggling to push through the pain. You've heard that some people use weed as a pre-workout supplement, but you're not sure if it's right for you. Well, in today's video, we're going to share some science-backed insights on the effects of weed on weightlifting. So, if you're ready to learn more about how weed can impact your gym routine and hear some stories from people who've tried it, keep watching. Weed, also known as marijuana, contains several compounds, but the most notable is delta-9-tetrahydrocannabinol, THC. THC is responsible for the psychoactive effects of marijuana, such as altered mood and perception, relaxation, and increased appetite. One of the potential benefits of marijuana for gym-goers is its ability to reduce pain and inflammation. THC interacts with the body's endocannabinoid system, which plays a role in pain perception and inflammation. This can make it easier to push through tough workouts, especially for those who suffer from chronic pain. Marijuana can also help with relaxation and stress relief, which can be beneficial for athletes who experience performance anxiety or struggle with recovery. THC can have a calming effect on the mind and body, which can help athletes get into the right mindset for training or competition. However, there are also potential drawbacks to marijuana use for athletes. One of the main concerns is that it can impair coordination, reaction time, and cognitive function. This can increase the risk of injury during exercise or competition. Furthermore, marijuana can also negatively affect lung health, which can be particularly concerning for athletes who rely on their respiratory function for their sport. Smoking marijuana can cause irritation and damage to the lungs, which can impair performance over time. Despite these concerns, there are several real-life athletes who have publicly discussed the use of marijuana. For example, former NFL player Eugene Monroe has been a vocal advocate for the use of medical marijuana in the NFL, citing its potential benefits for pain relief and recovery. MMA fighter Nate Diaz was famously seen smoking a joint during a post-fight press conference, and triathlete Clifford Druzinski has credited marijuana with helping him to manage pain and anxiety. Now, let's have a look at what science has to say. A study published in the Journal of Science and Medicine in Sport looked at the association between cannabis use and sports-related injuries. The study included over 2,500 participants and found that those who reported using cannabis in the past year were more likely to report a sports-related injury compared to those who did not use cannabis. However, it's worth noting that this study only found an association between cannabis use and injury, and it did not prove causation. Additionally, the study relied on self-reported data, which can be subject to biases and inaccuracies. Another study published in the Journal of Strength and Conditioning Research examined the effects of THC on muscle recovery after exercise. The study included 17 participants who were given either THC or a placebo and then performed a weightlifting workout. The researchers found that the THC group had lower levels of muscle recovery compared to the placebo group. Specifically, they had high levels of markers associated with muscle damage and inflammation. However, it's worth noting that this was a small study and further research is needed to confirm these findings. Another study published in the Journal of Cannabis Research looked at the effects of low-dose THC on exercise performance. The study included 15 participants who were given either a low dose of THC, a high dose of THC, or a placebo and then performed a cycling test. The researchers found that the low-dose THC group had improved exercise performance compared to the placebo group. Specifically, they had a higher peak power output and a longer time to exhaustion. However, it's worth noting that this was a small study and further research is needed to confirm these findings. Additionally, the study only looked at the effects of low-dose THC, and it's unclear whether higher doses would have the same effect. Overall, it's important to approach these studies with a critical eye and to consider their limitations. While they provide some insights into the effects of marijuana on exercise, they are not definitive and more research is needed to fully understand the topic. There are both positive and negative effects of marijuana use on weightlifting, and it's important to consider both before deciding whether or not to use it as a supplement. One potential positive effect of marijuana use is the placebo effect. Some weightlifters report that smoking weed before a workout can help them to feel more focused, energized, and motivated. While the actual physiological effects of marijuana on exercise performance may be minimal, the placebo effect can be powerful and lead to perceived improvements in performance. Another potential benefit of marijuana use for weightlifters is its appetite-stimulating effects. Marijuana has been shown to increase appetite, which can be beneficial for those looking to bulk up and build muscle mass. However, it's worth noting that this effect may be more pronounced with edibles or other forms of marijuana consumption, rather than smoking. On the negative side, smoking marijuana can have several harmful effects on the body. For example, smoking marijuana can increase blood pressure and heart rate, which can be concerning for people with pre-existing cardiovascular conditions. Additionally, smoking marijuana can have negative effects on lung function and respiratory health, which can impair performance over time. It's also worth noting that marijuana use can impair cognitive function, reaction time, and coordination, which can increase the risk of injury during exercise or competition. Additionally, regular marijuana use can lead to dependence and withdrawal symptoms, which can interfere with training and performance. If you still, however, choose to smoke weed, it's important to be mindful of the timing and dosage to minimize any negative effects on recovery or sleep. One study published in the Journal of Clinical Psychopharmacology aimed to investigate the effects of smoking marijuana on sleep quality and architecture. The study included 20 healthy adults, 10 men and 10 women, who had previous experience with marijuana use. Participants were randomly assigned to receive either a low dose of THC, 4 mg, a high dose of THC, 20 mg, or a placebo. The study followed a double-blind, randomized, crossover design, meaning that participants received each treatment condition in a random order, and neither the participants nor the researchers knew which condition they were receiving. The participants were instructed to smoke the marijuana or placebo cigarettes approximately 45 minutes before bedtime. Researchers then monitored the participants' sleep quality and architecture using polysomnography, which is a technique that measures brain waves, heart rate, breathing, and other physiological markers during sleep. The results of the study showed that smoking marijuana in the evening had a negative effect on sleep quality and architecture. Specifically, the researchers found that participants who smoked marijuana had reduced sleep efficiency, longer sleep onset latency, and increased wakefulness after sleep onset compared to those who received the placebo. These effects were more pronounced in participants who received the high dose of THC compared to the low dose. The study also found that smoking marijuana led to changes in sleep architecture, specifically a reduction in REM sleep. REM sleep is a stage of sleep associated with dreaming, memory consolidation, and emotional processing, and its disruption can lead to negative effects on cognition and mental health. Overall, the study suggests that smoking marijuana in the evening can have negative effects on sleep quality and architecture, which can impair recovery and performance in athletes. However, it's worth noting that the study was conducted in a laboratory setting with a small sample size, and further research is needed to confirm these findings in larger, more diverse populations. Another study published in the Journal of Sports Medicine and Physical Fitness aimed to investigate the acute effects of smoking marijuana on exercise performance and perceived exertion. The study included 11 participants, 9 men and 2 women, who were regular marijuana users and had previous experience with cycling. Participants were randomly assigned to receive either a low dose of THC, 15 mg, or a placebo. The study followed a randomized, double-blind, crossover design, meaning that participants received each treatment condition in a random order, and neither the participants nor the researchers knew which condition they were receiving. The participants were instructed to smoke the marijuana or placebo cigarettes approximately 10 minutes before performing a cycling test. The test involved cycling at a constant load for 8 minutes, with the goal of maintaining a constant speed. The results of the study showed that smoking marijuana led to greater perceived exertion during the cycling test. Specifically, the researchers found that participants who smoked marijuana reported higher levels of perceived exertion compared to those who received the placebo. This effect was more pronounced in the first 4 minutes of the test, and it could be attributed to the psychoactive effects of marijuana, which can alter mood and perception. However, the study found no significant differences in exercise performance between the marijuana and placebo groups. The researchers measured various parameters of exercise performance, such as power output, oxygen consumption, and heart rate, but found no significant differences between the two groups. Overall, the study suggests that smoking marijuana before exercise can lead to greater perceived exertion, but may not have a significant effect on actual exercise performance. However, it's worth noting that the study was conducted in a laboratory setting with a small sample size, and further research is needed to confirm these findings in larger, more diverse populations. Additionally, it's important to consider the potential negative effects of marijuana use on coordination, reaction time, and cognitive function, which can increase the risk of injury during exercise or competition. In conclusion, the effects of weed on weightlifting are complex and depend on a variety of factors, including dosage, timing, and individual tolerance. While some studies suggest that marijuana may offer potential benefits for weightlifters, such as reducing pain and inflammation, stimulating appetite, and improving mood, other studies have shown negative effects on coordination, reaction time, and cognitive function. Additionally, smoking marijuana can have harmful effects on lung function and respiratory health, which can impair performance over time. It's also worth noting that regular marijuana use can lead to dependence and withdrawal symptoms, which can interfere with training and performance. Therefore, the negatives of marijuana use far outweigh the positives for weightlifters. It's recommended to avoid marijuana use or limit it to after working out, and to focus on other strategies to improve performance, such as proper nutrition, hydration, sleep, and training techniques. As with any supplement or medication, it's crucial to consult with a medical professional before using marijuana, and to use it responsibly and in accordance with local laws and regulations. That's it for today's video. If you found this information helpful, please like and subscribe to our channel for more content like this. Thanks for watching, and we'll see you in the next one.